on the screen.
Oh, okay.
Yeah.
I get infusions. I get Tysabri once a month because I have multiple sclerosis. I was diagnosed about 6 years ago with the disease and have since gotten care here at Rush.
Rush Multiple Sclerosis Center is the oldest in the region and largest as well. And we have been on the cutting edge of providing patient care in terms of both pioneering certain treatments for MS, as well as being among the first to utilize novel therapies for people with MS. MS, or multiple sclerosis, is a disease that affects the brain and the spinal cord and is a result of the person's immune system attacking parts within the brain and the spinal cord, causing inflammation. And this inflammation can damage the ability of the nerves in the brain and the spinal cord to get nerve signals either fast enough from one point to another or not get them through at all. And as a result, people can have difficulties using their muscles or seeing properly, having trouble with balance and coordination.
So we're just basically preparing everything that we're going to need for when we go see the patient to get their IV started, get their medication going. It can be 4, 5, 6 patients in a day, sometimes more, sometimes less.
Rush MS Center has a highly professional team of healthcare providers at multiple levels with neurologists, advanced practice nurses or nurse practitioners, registered nurses, physician assistants, MAs, and we are all involved in providing high-quality care to people with MS. We have about 15 infusion chairs in the infusion facilities within the suite of the Rush MS Center.
Getting an infusion here at Rush is just another day in the life. It's routine by now. It's my new routine, having MS, and once a month I come and get my Tysabri medication, which is an infusion. I typically come in, I meet with the nurses, they make sure that I'm feeling okay, that I haven't had any major changes in my health, any new symptoms, and then they administer the medication. And honestly, while I'm getting the medication, I go about my daily life. I work, I check my email, I answer calls if I need to.
Once the patient is hooked up, I usually come back to my computer and open their chart and do some additional charting. I enter where I've placed the IV. I'm gonna get her lab paperwork and MRI paperwork ready because she's due for those diagnostic tests, and I'll be giving her that paperwork. And I would go check on other patients as well.
At the time of my diagnosis, was very vulnerable. I was very scared. I didn't know what my future really held. And after my first meeting with Dr. Safosky, I actually felt for the first time that I was gonna be okay, that my life was going to be different, but that I would still have the life that I always wanted to have. He gave me the hope that I could still have a family, that I could still work full-time, that I could still have everything I ever wanted, because as a 20-something-year-old that's been diagnosed with an incurable illness, you're obviously terrified, and he made me believe from the start that I would be okay.
She has been on treatment with an intravenous medication that is considered high efficacy and high potency and has done extremely well receiving this treatment, to the point where she is very high functioning with virtually no limitations, both privately and professionally. Ms. Randall has a business of her own that she successfully runs and is one of those people that is an excellent ambassador for not only Rush MS Center, but also for what can these days be provided to people with MS in terms of successfely controlling the disease.
I've gotten to know the nurses very well over the course of my time here at Rush. I know them all by name. Celeste, Jenny, Laura. I know that one has cats. I know that the other has children. I think they have been an exceptional part of my experience here at Rush because they're just warm and they're comforting and they take great care of you. But they're people and they treat you like you're a person too. And one of the nurses, Celeste, I actually saw out one night in Chicago on a Saturday night, and she was walking down the street and she screams, "Angie!" And I see her and I run up to her and I give her a hug, and people are like, "Who is that?" I was like, "That's my MS nurse."
Rush MS Center, with its location within the Rush Medical Center as a whole, provides the possibility of any level of care in case there are some adverse reactions to any of the medications that we may be administering people. Its location on campus is such that it allows for providing any level of care within a matter of minutes.
I feel safe knowing that I'm in the best place that I could be. I'm under the best care. They will do whatever they need to do to make sure that I'm okay.
Being able to be involved in patients' care on an ongoing basis for year after year is very rewarding. Helping people live better lives, more productive lives, more satisfying lives, suffering less from the disease such as MS, which still has no cure, but has good treatments that can help.
The reason to come to Rush is because it's the best place for you to get your infusion. And what I mean by that is you're under the care of your neurologist. You're under the care of qualified nurses. They are looking out for you and your best interest and are tracking the progression of your disease. I feel hopeful for my future with MS. Thanks to care that I've received here. Simply knowing that if new medications come out and new advancements are made, that I'm gonna be the first to know. I will have access to everything I need to really thrive with MS in the future. And that is incredibly comforting for me as a patient, as a person, as a mother, to know that I'm really in the best hands.